If your anxiety has improved over the course of listening to this podcast, you may be wondering how to maintain that progress. Or if your progress hasn't been what you hoped for, you may be wondering what your next step should be. Welcome back to Quieting Anxiety, a podcast by Excel at Life. I'm Dr. Monica Frank, and today we'll talk about how to keep the skills you've learned active, so anxiety doesn't gradually slip back into old patterns, and what to do if your progress hasn't been what you hoped for yet. Just because we are at the end of this podcast doesn't mean you are at the end of your journey. Before we begin today's episode, let's take a brief moment to settle. Take a slow breath in and gently let it out. Allow your shoulders to soften just a little. Take another slow breath and release it comfortably. As you sit here for a moment, allow yourself to notice where you are right now. Not where you think you should be, not where you wish you were, just where you are. If you've been listening to this series and practicing the skills we've discussed, you may have already begun to notice changes. Perhaps you pause and take a breath more often. Perhaps you notice anxious thoughts a little sooner. Or perhaps you've started approaching situations that once felt overwhelming. Even small changes matter. Progress with anxiety often happens gradually, step by step. So for just a moment, acknowledge the effort you've been making. Take one more slow breath in and let it out gently. Allow that sense of steady progress to stay with you as we begin today's final episode of Quieting Anxiety. If you have been listening along and practicing the skills we've discussed, my hope is that you have experienced at least some reduction in anxiety, or maybe you've achieved your goals. Either way, this episode is important to help you maintain progress and continue moving forward. Perhaps you have noticed moments where anxiety feels more manageable, or where you respond differently than you used to. Even small changes matter. Anxiety rarely disappears overnight. What usually happens instead is that you begin responding to it with greater understanding, greater patience, and better tools. And those tools are what today's episode is about. We are going to talk about two things. First, the importance of maintaining the progress you have made, and second, what to do if you feel that your progress has been slower than you hoped. Let's start with maintenance. Over the years of my clinical practice, I often saw a similar pattern. A client would work hard in therapy, learn cognitive and behavioral skills, and make substantial progress with anxiety. They might finish treatment feeling much better. Then sometimes a year or two later, they would return for additional help, usually due to a major change in their lives. When I would ask whether they had continued using the methods they learned in therapy, the answer was often the same. No, I stopped doing them. This is extremely common and it is very understandable. When people begin to feel better, it is natural to think that the problem has been solved and that the techniques are no longer necessary. But anxiety management skills work very much like physical exercise. If you exercise regularly, your body becomes stronger, more flexible, and more resilient. But if you stop exercising entirely, those benefits gradually fade. The same principle applies to psychological skills. The cognitive strategies, relaxation methods, and exposure techniques we've discussed are not temporary fixes. They are skills designed to become part of how you live your life. Think of them as mental habits. When you continue using them, they help maintain the progress you have made and protect you from sliding back into old patterns of anxiety. Many people who cope very successfully with life are using these same skills, often without realizing it. They may have learned them naturally while growing up. Perhaps their parents modeled calm problem solving or taught them rational ways of thinking about difficulties. Maybe they learned relaxation techniques through sports, meditation, or other experiences. You may have heard someone describe a stressful situation and say something like, "Then I took a breath and," or "then I told myself that I could handle it." Those simple phrases reflect powerful coping skills. Taking a breath is a relaxation response. Telling yourself something helpful is cognitive restructuring. These are exactly the types of life skills that cognitive behavioral therapy teaches. The goal of this series has been to help you learn those same tools intentionally so that you can use them whenever anxiety arises. And the key word here is use. The benefits of these skills comes from continuing to practice them, and especially using relaxation methods more often when you notice tension building. Continue to challenge anxious thinking when worries start to spiral. Use the cognitive diary to examine difficult situations and learn from them. Generally, face situations you have been avoiding. These are lifetime skills. They are not something you stop using just because you are feeling better. In fact, feeling better is often a sign that the skills are working, and continuing to use them helps keep things that way. For some people who have achieved their goals, especially those who have experienced more severe or long-lasting anxiety disorders, another helpful strategy is occasional professional support. Some clients find it useful to have therapy sessions less frequently, perhaps once every few months, to review skills, address new challenges, and maintain progress. Think of it as similar to periodic checkups for physical health. It is not a sign of failure. It is simply a way of reinforcing the tools that help you stay well. Now let's talk about the other possibility. What if you have been listening to these episodes and practicing the techniques, but you feel that your progress has not been what you hoped? First, it is important to remember that anxiety recovery often takes time. Changing deeply ingrained habits of thinking, feeling, and responding does not happen quickly. Progress often occurs gradually, sometimes with periods where it feels slower than expected. But there are several things you can do that may help move things forward. The first suggestion is to review the material. You might consider listening again to some of the earlier episodes. Sometimes concepts that seemed abstract the first time become clearer when you hear them again after having more experience with the techniques. Learning CBT skills is a bit like learning a new language. Repetition helps deepen understanding. I've often had clients tell me they need to review the cognitive materials a number of times, and I explain to them that is part of the process. They may need to read or listen to something several times to fully understand the material. Second, consider whether you have had enough practice with the tools. Many of these skills improve with repetition. Relaxation techniques, mindfulness exercises, and cognitive restructuring become more effective as they become familiar. If you have practiced only occasionally, increasing the frequency may make a significant difference. Using the cognitive diary frequently can also be particularly helpful. Writing down situations, thoughts, emotions, and alternative perspectives helps train your mind to notice patterns that might otherwise go unnoticed. Third, consider whether additional guidance might be useful. Some of the more intensive techniques we discussed, such as structured exposure methods, can be more effective when done with professional support. A trained therapist can help you design a plan, adjust it when needed, and provide encouragement during challenging steps. If anxiety has remained severe or continues to interfere with daily life, seeking professional assistance can be a very valuable next step. There are many effective treatments available, and you do not have to face anxiety alone. Before we finish today, take a moment to reflect on something. Think back to when you first began listening to this series. Notice any ways, large or small, that your understanding of anxiety may have changed. Perhaps you recognize anxious thoughts more quickly. Maybe you are more aware of physical tension in your body. Or maybe you have begun to approach situations you once avoided. Every step toward understanding and responding differently to anxiety matters. Your task for today is to write down what you have noticed. Sometimes people don't realize the progress they have made until they see it in black and white. It can be helpful to review the methods you have learned from earlier episodes to see how you have incorporated them into your life. And your journey may not be finished, so it may be useful to review your goals because often people have developed new goals once they have achieved the original ones. If you have, take the time to determine what skills you have learned that may help you achieve these new goals. Before we finish today, let's take one more brief moment to settle. Take a slow breath in and gently let it out. Allow your shoulders to relax. Let your breathing return to a comfortable rhythm. Remind yourself that the skills you've been learning are not just techniques for difficult moments. They are tools you can carry with you throughout your life. Whenever anxiety begins to rise, you can pause. You can take a breath. You can notice your thoughts and gently guide them in a more balanced direction. These skills grow stronger each time you use them. Just like exercise strengthens the body, practicing these methods strengthens your ability to respond calmly and confidently. So as you move forward, remind yourself, I can keep practicing. I can continue using what I've learned. Progress happens one step at a time. Take one more slow breath in and gently let it out. And as you continue with your day, carry with you the knowledge that these skills are always available whenever you need them. If this series has helped you begin that progress, then it has served its purpose. Thank you for spending this time learning and practicing with me. This has been Quieting Anxiety, a podcast by Excel at Life. I'm Dr. Monica Frank, and wherever you are on your journey, keep practicing, keep breathing, and keep moving forward.